been a long time. So, how are you doing? Has your hip doctor seen you lately?
Yeah, we got some issues. I hate to say it, but they gonna have to go back in me. This side didn't want out.
Yeah.
So
What are they gonna do?
I'm trying to get it while they didn't tell they go ahead and cut me all the way down yet.
Yeah.
And they say I told him
What's he gonna do?
he's going to well, the Hesse didn't want to touch me.
Yeah, I remember that. He was.
Yeah, so he's like, he gave us this time because he had so much problem with me. He had never had nothing get infected and all this. So he sent me to Dr. Pepper. Dr. Pepper say he would go on it because
Dr. Pepper's good.
Me with my back and then have me shift is causing a lot of stress.
Because the way you walk,
and I'm walking,
it strains your back.
Exactly. Now I got where I'm humping over and it's hard me.
Man.
That's what I'm saying. As I raise up down, it hurts bad.
Oh yeah, because you're not supposed to be like this.
Exactly. And now that I got it, I'm starting to lean. And when I'm walking now, my wife's like, my kids like, stand up, daddy, and I don't even know that I'm doing it. And so like between this and that, it's very aggressive in my lower half, causing stress on one side and the upper middle part too.
Yeah, it's all related. A lot more. In fact, we're learning is more related than we ever thought. I'm looking at. I'll have to look some more. I'm looking at this. What I see here. These. This is fused. This is fused. This looks fused. They look fused. We just got to be careful the fusion doesn't break down. If you start bending forward, at the bottom.
That's what it's doing. So I'm trying my best to stay. It's just like humping me over.
I don't see that it's doing it yet, but I think we have to check them. Fortunately, it's got enough bone there. The one that's at the most risk is 3-4. For some reason, that one is under the most stress.
That's what some feel like. I'm gonna tell you the truth, where it feels me. If I move wrong somewhere, like a cracker type. Like if I pull, it pulls so all of my skin like a tear. Then it's like I had to get back because I feel like a joke force down there.
So, and then we look at 5, 4, 3, 2. Let me just write this down. I got a pen in my pocket, so you can keep it straight. So L3-4, it's kind of got a little bit of a it's kind of bending forward a little bit.
Yeah, I feel it. I'm trying as I lean up though, it hurts me.
I know.
It's like I gotta catch a neutral spot if I don't.
I have to figure out why it's hurting you.
Because if I lean straight.
I think it's partly because your back is flat. It's not. You don't have as good a curve, and that causes some of this. Because you had surgeries by different doctors, then we would do just 1 or 2 levels, and then we did another level.
This is a nightmare. I'm tired of getting cut on.
Yeah. So 3-4 fusion is. Can I say for sure it's fused? No, I can't say for sure. Questionable. Okay. Fusion. Questionable. And then 2-3 is solid. 1, 2.
A lot of torque.
That's 3, 4. The Freeman's open on the left and the right. Just concerned about that fusion. We're going to keep a close eye on it. Do you have any pain in your legs?
Yes, I do. One on this side, about my bone in front, and this right in here, and this definitely something shooting right here.
Like here?
Yes, I told him that too. That's burning. My groin area here hurts me bad on the side and down.
So that would be the upper. But what about here on the?
This is where I'm burning, like right here on this little thigh section.
Right
yeah,
side?
Yeah, and this little part down here and here.
That's where we put one of those big cages in.
Yeah.
On the side.
Yeah.
Everything's perfect there. This one just might need a cage.
Oh, girl.
I'm hoping not, but. And then this one, it was pretty good.
That's what you stopped the other one with a cage, didn't you?
Yeah.
The force was, yeah. That's what you,
So we did the lumbar. I want to look at the thoracic now. As far as the roots, the nerve roots look good there. They look good there. If there's motion, it can make the nerves hurt. Once it fuses, that usually goes away.
okay.
I just worry about 3-4. I don't know. I mean, there's all this bone here. It just didn't seem to. They didn't stick together. The pieces just sat there. You know, it might have been related to you getting an infection, and they had to take the screws out.
They touched my lower half. Wasn't nothing going there with it. No infection getting in there. Okay, I'll make sure.
No.
Whew.
So nothing really bad touching the nerve or pinching the nerves.
Okay.
Nothing that's going to make you paralyzed.
Okay. Ooh, that's not a metal.
Yeah.
That's a straight bar. I mean, it ain't giving no bend at all.
You know, you're bending up here.
Yeah, but it's down that lower part. That's what's caused me to hump. Yeah, it's causing no force on my back right there.
Screws all look good.
That's good.
Nothing's coming out or anything.
That's good.
Some of them are fused. This one and this one. This one's not quite, but they're progressing.
That's
The
good.
bone is growing,
That's good.
so it's going to probably take a whole year. You know, maybe. Usually it takes a year. For you, it might take just a little bit longer.
Yeah, I ain't no minute year one time.
But we gotta watch that bottom area.
Okay.
I think it's okay for you to go ahead and get the hip fixed though.
That's what it's
And
talking
then we will look
about.
at your back again and see what's still hurting.
Okay.
And then probably they will have you do therapy with your hip.
Yeah, I was just waiting to have everything and get through with
After you get it
this.
done, they'll get you in some therapy and let them know about your back.
No, I don't have to be in trouble like this, believe me. I'd rather be at work.
Yeah.
I don't want to be like this.
Well, we'll give you a referral for another pain management.
Okay, I appreciate you.
I should
I just don't
stay in
keep.
your network.
Yeah, I'm finna have surgery. I don't have time. Nobody going
Hold
off.
on to this in case
Yes,
you
ma'am.
got to prove to people you've had back surgery.
Yeah, for real.
never
Last time
know.
they didn't believe you. Now, how
Yeah.
you don't believe me with a big old scar on my back? And then she called. I'm like, it was crazy.
Yeah,
All right,
it's a
thanks,
fake
Dan.
scar.
Yeah. Exactly. Hey, how you doing, stranger? So you hanging in there?
Yeah. So we're going to have you come back after your hip surgery.
Okay.
I don't know if we need to get films.
I figured that.
We already got films, so
Okay.
I think I'll see how you're doing, and then we'll decide if I need to get anything else. He's so tall.
I know.
It doesn't fit him. He needs it one for tall people.
He needs it better fitted. You can be fitted better.
Can it?
Yeah, it's
Where
not
did you
fitting
get that
right.
from?
They fitted me. They came to the house and did it.
Okay. Okay. Then I know who it is.
All right, then we'll get him to fix it because
Okay.
they've got you fitted like you're 5'4".
Oh, okay. I was like, this thing is not holding me.
That would work for me. Yeah, this has got to.
Okay,
You
yeah.
are taller than that.
That's
and you
probably
need to
why I
have
heard
it-
so much lower pain now. Huh?
Yeah, because they're not covering
It's
it.
not holding. That's what it is then.
Yeah.
Okay. Yeah, that makes a lot of sense.
And then
Hey,
he has a referral for
Can you
pain
put that
management.
on his thing so I can so it reminds me to send a note to Nick?
Appreciate you once again, Diane. Thank you.
He'll come back out and help refit you.
Okay. Yeah, because it ain't holding me nowhere but top part. The lower part doing this.
We're glad we saw that. I think
Yeah.
I think it's going to help when it
Yeah,
comes
I
down to
guess
your
it's done.
hips. It holds you
Yeah.
down here. This is what you need.
Yeah, 'cause there ain't no stability. I mean, this
Yeah.
none at all. Okay, thank y'all once again.
Bye.
All right, good seeing you again.